Cancer is a complex disease and it's not diagnosed or staged by single test. More than one test are required. Now, when you arrive at a certain diagnosis or a certain stage of the disease, there may be more than one options available to treat that patient. How do you exercise your judgment at that point in time? The judgment, as I said, is based on the inputs and the available data and the evidence that how a particular tumor for a particular stage should be treated. And this research comes from a large-scale randomized trials. A lot of research is done, and then these are put out as what is called as standard of care. First time somebody walks into the clinic, a standard of care is always offered. You don't offer any experimental treatments. And one goes through that standard of care, and unfortunately, if somebody fails that treatment, then you need a second line or a third line treatment. There may be evidence to a second line or a third line treatment, and there may not be an evidence in a particular tumor type. So what do you do in that? Any hospital would have a multidisciplinary team or a tumor board type of a setting where you take these cases, discuss with your colleagues. Several minds are better than single one, and take those inputs. Maybe somebody has encountered that type of a situation in his career, in his or her career, and would be able to make the whole team wise enough. At times there is no evidence. The entire process, whether it is standard of care, treatment after failure of first line or a second line of treatment, there is a scope for taking a second opinion. A second opinion does not mean that it's a no confidence vote on your primary doctor. We encourage families to take second opinions on the clinical aspects, on pathology aspects, or even on the radiology aspects.